Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about heart disease in women, the growing problem of antibiotic resistance, and autism resources and research. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hello, everybody. I'm Amy Marsalis. Good to have you with us. Dr. Melissa Walton-Shirley is my first guest today to talk about heart health, particularly in women, because despite so much conversation about breast cancer, which is a huge focus and should be of our attention as women, heart health is actually, heart disease is our #1 killer. Isn't that right?
Absolutely. And you're correct. We need to focus on breast cancer awareness. But people don't really understand the scope of heart disease in women. 1 in 31 women will die of breast cancer. 1 in 3 women will die of heart disease. And that does not even take into account the prevalence of heart disease in 1 in 4 women.
Why is it that women are not paying as much attention? You know, the campaign Go Red for Women has been around quite a long time. I was involved with that several years back and did a lot of medical reporting. Are women getting the message?
They're getting the message, but the problem is that we're in denial. And we are the consummate multitaskers. So we're taking care of our parents, our children, our spouses, but we're not doing a very good job of taking care of ourselves. Furthermore, women don't enroll in studies like we should because we're just so busy. We're focused on picking up the children, picking up the laundry, taking care of the household and our jobs, and we just don't seem to enroll or take the time to take care of ourselves and examine ourselves or listen to our symptomatology.
And symptomatology, speaking of that, what are the symptoms for women? Because I remember, if things haven't changed, those symptoms could be a lot different for women and present themselves differently than in men. You may not have the crushing chest pain.
Absolutely. We do occasionally have typical presentation, and that's easy for your practitioner. If you come to the emergency room or your physician's office, grabbing your chest, saying you're having chest tightness, chest pain radiating into the jaws or the arms, that's fairly classic. But unfortunately, many women present with a prodrome of just extreme fatigue, and the fatigue is often an indicator of an inflammatory problem, maybe a subclinical infection of some sorts. And then we often have upper back discomfort and shortness of breath upon exertion. The problem is that we don't just have a heart attack from fixed obstruction within the artery or a blockage in the artery. We also are subject to coronary vasospasm, meaning that the artery just suddenly spasms, creates a stagnant flow state, and then clotting, and then we get muscle death, which is the definition of a heart attack. So we have to be ready. Typically, any symptom from the belly button to the level of the earlobe, front or back, that results in an impending doom type feeling, shortness of air, chest pressure, those are more typical for the atypical presentation of women.
What would cause the spasm?
Well, we think there are a lot of things. For instance, the lack of estrogen may make us more prone to spasm in some situations and then less prone to spasm in others. Adrenaline surge, for instance, particularly stressful situations like a death in the family, a chronic illness in a family, difficulty with interpersonal relationships, those things make us very prone, but also smoking. The #1 cause of coronary vasospastic angina in the younger population. And I have treated several patients in their late teens, mid to late 20s, early 30s that have had coronary vasospasm. They have a heart attack pattern on their EKG, or they have enzyme leak on their lab work, but when we take them to the cath lab, they don't have fixed obstructive disease, yet they've suffered a heart attack. So it's really important to try to figure out what type of heart attack your patient suffered from.
what are some of the other risk factors? We know smoking, but your genetic predisposition is a big factor. How big of a factor is it?
Oh, absolutely. It's one of the biggest factors. You know, smoking can move your genetic predisposition earlier. We've seen in twin studies now that there are genes that are actually turned on by tar. And twin studies have demonstrated that the non-smoking twin is free of coronary disease. The smoking twins already had an angioplasty and maybe a bypass surgery. So smoking is a biggie for risk factor. But there are also the traditional risk factors of hypertension, high cholesterol, particularly elevated LDL. Unfortunately, diabetes is rampant in our population. And if you calculate your body mass index and it's in the 30s, and you do that by Googling your body mass index, scoring your height across your weight, if you're up in the 30s, then most people are glucose intolerant, which is a very nice way of saying that you're diabetic. It creates an inflammatory condition and increases our risk of heart attack. Then there are kind of the non-traditional risk factors of rheumatoid arthritis, psoriasis. Those things are inflammatory conditions.
I've got two more quick things before we wrap up. LDL, that's the bad cholesterol,
That's right, yes.
And that's the one, HDL you want to be high.
That's right.
High density.
That's right.
And you can raise that with exercise, right?
Yes, absolutely.
Okay, but one thing that we've got to touch on before we wrap up is the test. You said that if you don't do anything else, get this test. Let's talk about the CT test you mentioned.
Yes, CT coronary calcium scoring. It's been a game changer for me as a cardiologist. So for a patient in their 50s who have significant risk factor profile, we as adults should never have any coronary artery calcium. So we're born at a level of 0. And if we can make it through our entire lifetime with a calcium score of less than 100, then our risk of heart attack is much lower than patients who, say, walk in with a calcium score of 5,000 or 10,000. And it's really, really easy to do that test. As a matter of fact, we talked about breast cancer in women and how we're very willing to do a mammogram, but we don't like the thought of the hassle of a stress test. You just walk into the CT scanner, no IV, no contrast. You don't even have to get undressed unless you have wire in your bra. You get on the CAT scan table, hold your breath 10 seconds, we photograph your blood vessels, and there's a package on the CT scanner that calculates the calcium score.
How do you get the test? I mean, how do you set it up, arrange it?
Unfortunately, Medicare and third-party payers don't pay for it, but fortunately, it's very affordable. It's the best $69 to $100 that a person will ever spend as an adult, and preferably in patients over the age of 50, unless they have a really dense family history of heart disease at an earlier age. So you can learn a lot from it. It's very difficult to have a heart attack with a calcium score of 0.
Okay, one last quick piece of advice in the next 15 seconds before you go. Most important thing women can do to take care of themselves.
Mediterranean diet, Google that, walk 30 minutes 5 days per week, have your blood pressure checked, beg your heart specialist or your family doctor to do a 2-hour glucose challenge. Don't smoke. That's my best set of advice right there.
All right, boy, you're good. You've done this before.
A few times.
All right, and love the outfit.
Thank
you for coming in
Go
and
red
sharing.
for women.
Yes, go red, ladies, go red. All right, and men, support your women and make sure they get their hearts checked. Dr. Melissa Walton-Shirley, thanks so much.
Oh, thanks for having me. We appreciate it.
Okay, thank you. We'll be right back. In this segment, we're going to be talking about a naturally occurring phenomenon known as antibiotic resistance, and Dr. Pam Talley is a medical epidemiologist with the Tennessee Department of Health. Thank you for coming in today.
Pleased to be here.
All right, so this happens, it's a naturally occurring kind of condition, but what has caused it to become such an epidemic, particularly in our fine state of Tennessee? You said we don't rank very well when it comes to this.
Right. So organisms, bacteria, fungi, viruses can change genetically and mutate and develop resistance to antibiotics. And that allows the organisms that have not been killed to multiply and survive. And so the more we use antibiotics, particularly inappropriately or when unnecessary, that allows antibiotic resistance to increase and become more problematic.
And that's where they're just not going to work. The person
Correct.
can really become sicker, and your choices of how to treat them become more and more limited. Is that the end result?
That's exactly right.
All right, so in Tennessee, you said where do we rank?
So the most recent data from the Centers for Disease Control suggests that Tennessee is 47 out of 51, so the 50 states plus the District of Columbia, in terms of the number of antibiotics prescribed per 1,000 people. And it's significant enough that we are actually 2 times the rate of antibiotic prescriptions compared to some states on the West Coast that are really doing quite well. So we have some significant work to do in Tennessee.
All right, a lot of challenges then for the Department of Health, your job. Okay, why do you think that is? Why does Tennessee have such a problem with this?
Well, I think it's a culture. People perhaps expect an antibiotic when it may not be necessary. We know that physicians report feeling pressure from their patients to prescribe an antibiotic in a situation where it is not helpful.
Maybe they call in, they feel
call
terrible.
in. Everybody feels miserable when they're sick, or when you have taken time off work to take your child to the doctors when they're sick. And we want a quick fix, but it's important to realize that antibiotics are often not only not a quick fix, but have harmful side effects as well.
All right, so when are they most appropriate?
So they only treat bacterial infections. We know that from recent studies that about 30% of antibiotics that are prescribed in the US, perhaps more in Tennessee, are unnecessary because they're used for viral infections that they don't do any good for. If you have a virus, you've been given an antibiotic and you feel better in 2 days, you think it's great, that was a fantastic antibiotic, when in fact the virus is very likely to have gotten better and made you feel better naturally. And so there's that mismatch in terms of expectations the next time you get sick. So sinus infections, colds, many ear infections are often caused by viruses.
And so you really shouldn't have any antibiotic.
No.
I think there is confusion over that.
Right.
Okay, so the bacterial infections that would be appropriate for the antibiotic. Give us some examples of what.
Well, some ear infections are caused by bacteria.
Okay.
Sometimes that's hard to tell. For example, in the first several days of an ear infection, a pediatrician might choose to observe and see which direction it goes before prescribing. Sinus infections are usually caused by viruses, perhaps until you've been sick for 8 or 10 days and worsening. That's often a suggestion that it's bacterial, no longer viral.
Okay, so what is your department, the Tennessee Department of Health, what kind of steps are you taking to improve this ranking that we have that could be very dangerous?
Right. So first of all, we want to make sure that we try and prevent illness in the first place. So we do a lot of work on hand washing, hand hygiene.
Don't get sick in the first place.
That's right. And encouraging influenza vaccines for everybody 6 months and older who doesn't have a medical reason not to get one, plus pneumonia vaccines for individuals at a certain age for whom they're recommended. Beyond that, we track antibiotic resistant organisms. There are a number of organisms that are reportable by healthcare providers and laboratories so that we can see the trends that are happening in Tennessee. Is it getting worse? Is it getting better? Are our efforts making any difference? We're also working with partners across the state on what's called antibiotic stewardship. So it's education and a commitment from people to try and prescribe the right drug at the right dose for the right duration of time. So really a range of activities that are ongoing to try to improve this in Tennessee.
Do you think that people, it is sort of a two-way street, not just the doctors prescribing these drugs, but the patients? It's almost incumbent upon, the parents and adults, patients, to really monitor and know when it's time to get to the doctor. Don't wait till you're so desperately sick to go in to see your doctor.
That's right. But then to ask appropriate questions like, do you think I have a bacterial infection? Is an antibiotic going to help me? And don't, if your provider makes the decision that yes, you do have a bacterial infection and could use an antibiotic, it's best not to ask for a particular brand of antibiotic. What you've been given in the past for a different infection may not be the appropriate antibiotic for your given circumstances. So best to ask questions and have a two-way dialogue so that your provider understands that you're an informed consumer and makes a decision together about what's the best treatment for you.
Okay, where can folks go to get more specific information, to really read through some material and learn more about this so they feel more empowered?
Right, so the Centers for Disease Control nationally has a big push that's been ongoing for a number of years called Get Smart. Its aim is both to educate healthcare consumers as well as providers about the appropriate use of antibiotics. There's also been national attention. There's been funds directed towards all the states to try and track antibiotic-resistant organisms, and those things can be found through the Centers for Disease Control website as well.
All right, and when you say wash your hands, just good old soap and water works just as well, right?
So in healthcare settings, the primary recommendation in most situations is for alcohol-based hand sanitizers, but there's nothing wrong with good old soap and water.
All right, okay, can't wash your hands enough.
And I think the other thing that's helpful to think about this, particularly during cold and flu season, is to try not to touch your face, eyes, and mouth.
Yeah, that's key. All right, thank you, Dr. Talley.
Thanks for
Appreciate your
having me.
time. All right, and we'll be back with more right after this. Stay with us. Next, we're talking about autism resources as well as research right here in our own backyard at Vanderbilt. And I have two guests today, Lauren Weaver, Director of Community Engagement with Triad at Vanderbilt Kennedy Center, and Sarah Carpenter, who is the Outreach Coordinator at Triad at Vanderbilt as well. Welcome, ladies.
Thank you.
Really an important topic, so many children diagnosed with autism in our community and around the United States. Let's start first with the program Triad and what that encompasses. Lauren, what does that really stand for?
Yes, Triad is the Treatment and Research Institute for Autism Spectrum Disorder, and it's a program at Vanderbilt Kennedy Center. And we're working to improve assessment, treatment, education, and community services for individuals with autism and their families while advancing knowledge and training in our community.
So when you talk about assessment, identifying autism, you typically would probably see a family, see children after they've already maybe been to see other specialists or pediatricians, or do they come to you first? How do they get to you?
It can be either. So they can, express concern to their pediatrician. The pediatrician would recommend coming to see a specialist or professional within psychology at Triad, and so they can come and get an assessment to kind of identify if there is autism or maybe another concern.
Okay, so for those people who are not familiar with what the autism spectrum is, because we know there are different levels of this condition, but the key thing is to identify it as early as possible so you can have the intervention and really help these children as much as possible. So define this for us?
Yes, so autism is characterized by deficits in communicating and forming relationships with others, as well as using language and abstract concepts. And so there's just one diagnosis now that's actually a recent change. So we used to have the different levels of Asperger's autism
yes.
spectrum disorder, and that's actually changed because of some inconsistencies with the way that it was being diagnosed in different areas by different people. And so now it's just autism spectrum disorder.
That is fairly new. I hadn't
Yes.
heard of that. So tell us, maybe describe some of the, if you could, in layman's terms, some of maybe the physical characteristics or the behavior.
Yeah, so there are no physical attributes associated with
Okay,
autism,
that's good
which
to know.
makes it challenging to identify, one, as a community member, how do I help this person who I can see is having a hard time or needs extra support? We don't have those physical attributes to know. We just see a child having a hard time in the grocery store. But some of the behaviors that we look for are delay in language, maybe having a hard time making eye contact or communicating with someone else, as well as some restrictive or repetitive behavior. So sometimes we see things like flapping hands, pacing back and forth, lining up toys, or playing with objects in an unusual or non-functional way.
You know, it's just atypical behavior.
Yes.
Okay, what does Triad do then? Once you get them in and you do the workup and the assessment, then what?
There are a lot of different avenues, but the most important thing is try to get services as fast as possible. So you mentioned a bit about early intervention is an important part of supporting someone with autism. So there is no cure for autism, but there are effective treatment options, and the most research-based treatment is applied behavior analysis therapy.
Okay, what does that mean?
A behavior analysis is a science that really looks at how people learn. And so we look at behaviors in the environment and setting it up so that a person who learns differently can be successful.
Sometimes these children can be mainstreamed, correct?
Yes, yeah. So one thing I love about my job is working with people with autism, because they're just like you and me, and
They
that they're
sure are.
unique,
Yes.
and have areas of strength that teach me new things all the time. One of my favorite people to work with works at Vanderbilt, and it has autism, and we have great conversations about things from craft beer to music. I love working
That's
with her.
fabulous. Okay, Sarah,
Yes.
why should Tennesseans get involved in this program, Spark? If you would define that and tell us why we need to know about it.
Yes, of course. So Spark is something really, really special. There's a network of 21 clinical sites across the United States, and we're trying to figure out new causes of autism, identify new genes related to ASD. And Tennesseans can benefit from participation. There's a potential to receive genetic results from participation, and there's compensation of up to $50. And we're really trying to advance the science and the research. Simon's Foundation is our project sponsor. They're out of New York City, and they've made this thing happen. And I represent Vanderbilt in the overall study.
And aren't you looking at, did you say 50,000?
Yeah, 50,000 families we're trying to engage with, and I think we're almost or maybe halfway there. We have a lot of work to do still, and we've been at this at Vanderbilt for 5 months, and we've got almost 1,800 participants in Spark, and it's incredible, but we need more. We simply just want to engage with as many families as we can, and hope that they find it beneficial.
Okay, if someone wants to get involved, what should they do? How can they contact you? I think we have some information, yeah, we do on the screen, but what else, how do they reach you?
So if the website's on the screen, it's sparkforautism.org/VU. I'll become your coordinator once you register. Registration happens completely online, which is also very cool. There's no appointments, there's no travel. We are collecting DNA, but it's in the form of saliva instead of blood, which makes it, I think, a little less painless to be a part of, and families are really loving that aspect. So just go to the website, register, and I'll be your coordinator. I'll be the one talking to the families and help you along if you have any questions.
All right. Okay.
Yeah.
This is so exciting for our community. I'm glad to hear of, and the fact that the change in how it's regarded, instead of including Asperger's syndrome.
Yes, so it's still that there's a spectrum.
Spectrum.
The way that the characteristics kind of are for every person is different, but we're able to more easily just talk about with autism as one diagnosis.
Okay. All right. Thank you both, Lauren and Sarah. Appreciate
Thank
your
you.
time.
Thank
Good
you.
luck with
Nice
the
to meet
study
you.
too. Nice to meet you both.
Yes.
All right. We'll be right back after this. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.